LegalServer MLP Community Call. We're so happy to have you on the call today. Just a quick background on me. I am Mallory Curran, and I was a legal services attorney for 13 years with a focus on medical legal partnerships. You can see my contact information there. I welcome phone calls and emails if you have things that you want to talk about. I lived for many years in Cleveland, and Cleveland is near and dear to my heart, so I'm sharing this piece of public art, which is from Slavic Village in Cleveland. And you'll see throughout the presentation I'll have different public murals just as a little way to break up our call, and also have some beautiful color in our presentation. And in the interest of transparency, I just want to be really clear about my relationship to LegalServer. I'm not an employee of LegalServer, but I do consulting on LegalServer and on medical legal partnership, and sometimes on both at the same time. So I have worked with LegalServer quite a bit, and I also work with programs large and small on medical legal partnership and all other types of LegalServer projects. And I just want to say hello to all of you on the call today. We have a mix of legal and healthcare team members from medical legal partnerships, as well as legal services managers and LegalServer administrators, who you might know as, quote, your LegalServer person. And I want to acknowledge also that a lot of you are experiencing a lot of weather today, extremely cold temperatures, or a lot of snow, or any snow in places where there isn't usually snow. So I just want to acknowledge that there's a lot happening, and thank you for being here today. And our thoughts are with you and your clients as you're facing these difficult situations. A couple of housekeeping details. Everybody is muted. There is a chat box where you can enter in questions, and Leah will be monitoring those. We'll have some time for questions at the end. And Leah, if there's a question that comes up that's particularly relevant to something we're talking about, feel free to interrupt. You can unmute yourself as needed, and also want to clarify that this session is being recorded and will be posted on YouTube so that people who weren't able to be here today are able to watch it. And I also just want to address kind of why we are here, help us feel grounded before we start. So we're here in the medical legal partnership space because we care about community health. We want to increase health equity, and we want everyone to have the best chance for a healthful life, regardless of whether they were born, where they live, where they go to school, what their race is, ethnicity, gender, sexual orientation, gender identity, and so on. And in medical legal partnership, we work to enforce laws that are designed to promote or protect health, and we work to improve policies or develop new laws to increase health equity. So I always want us to remember that big picture, why we are here. And then we're here in this web conference space today talking about LegalServer because medical legal partnerships can leverage LegalServer to improve their workflow, to make it easier to collect important data about the work that you're doing, and to share with your healthcare and other community partners the results of your efforts. And just a quick few words about the MLP features. With the support of the National Center for Medical Legal Partnership, we work together with LegalServer and me to create the MLP features in LegalServer, along with a number of piloting organizations. They launched in 2016, and we've refined them and expanded them over time. And to make clear that the MLP features are free for anybody who uses LegalServer. The features are just there, they're available, and they do not need to be activated. And also want to make clear that this session is not a review of all of the MLP features. And I had put into the chat the video introduction on YouTube that gives a nice overview of what the features are, and then also a YouTube video of the last community call if you missed it. It talks about some of the features that have evolved a bit over time, some examples about how people are using them. So our topics for today, I am just going to do a quick rundown of MLP features in LegalServer, so that's not the purpose of this call, but I think it's helpful for people to have a reminder of what those features are. We're going to talk about recent improvements to the MLP features. We're going to talk about using LegalServer to manage MLP referrals and intakes, and we have two very special guests who are going to talk about that today. It's Rachel Baldessaro from the Center for Elder Law and Justice in Buffalo, New York, as well as Elise Centrini from LAF in Chicago. We're also going to talk about some current and future LegalServer related projects, and then there'll be time for questions, comments, and ideas. This is another mural that I really love. Okay, so just a very quick review of the features. A reminder that there's this configuration guide available for download for people who want to set up the features on their own. Many organizations have set them up on their own. Others that have come on board to LegalServer since they became available worked with LegalServer to set them up, and then other people have worked with consultants such as me to set them up in their system. So just a reminder of everything that you can do right now. You can record referrals received from healthcare partners. We're going to talk a lot about that today. You can use branch logic to ask MLP specific questions during intake. You can add to or update your information during a case. You can create a special MLP case profile view. You can collect MLP information when you're closing a case. You can track MLP consults. There's a number of ways to do that, and we talked a lot about it on the last community call. That's through outreaches or other services, group cases, or pre-screen. You can track facilitated referrals, also known as warm handoff, through the same outreaches, group cases, or pre-screens. You can track trainings, and you can run reports with MLP-specific information. This is another one of my favorite murals. This one is in LA. Okay, so I'm going to start talking about recent improvements to MLP features in LegalServer. And I've got to say some of these are kind of like, you know, under the hood type improvements, so they're not necessarily flashy, but pretty important. So the first of that is the MLP system fields are included now in Quick Case Copy and in New Case for Client. So for your staff who creates a new case for a client who's already there in your system, hopefully this has already saved a lot of time for those staff members because all of the MLP system fields, those are the MLP fields that are available to everybody, are included in Quick Case Copy and New Case for Client. So LegalServer did that for free. So thank you, LegalServer. MLP system fields are also now included in e-transfers. So if you get referrals through online intake for your MLP, or if you share cases with a different legal services organization and you transfer those electronically, the MLP system fields are now included in e-transfers. We'll talk about this a little bit later on. You can now designate an originating program for online intake. I think that's going to be important and handy for people who work at organizations that have more than one online intake that is used. So for example, maybe you have a general online intake that potential clients use to complete for themselves. They want to be considered as a client, as a potential client. And then another one, for example, where your MLP partners are entering in referrals of patients into an online system, and you want to be able to separate out where those are coming from. And we also, just this morning, added reports to the help page and example reports. So those are sample MLP reports. That's something that I've been saying I was going to do for a long time, and finally it is done. So those are now available for you to import into your own LegalServer, and it includes, you know, virtually all of the MLP fields are available there. So hopefully it'll be easier for you as you want to customize your own reports. You have a nice report to start from. Also, there's something called the generic lookup selector in LegalServer that's not MLP specific, but is still great. So on certain forms, you can limit which drop-down menu options show up. So you don't have to list everything in a list. Maybe for one program you want to see 3 of the drop-down options, and another program you want to see a different 3 of the options that are in that drop-down. You can customize that, which I think can be handy for MLP. And then there's also these action drop-downs and case lists which is not MLP specific, but still great. And I wanted to make sure that people knew about it. So I'm just going to show you a couple pictures here. First, these are the example reports. So if you go to the help page, you can search sample reports or example reports, and you will find a whole bunch of really handy reports that you can upload into your LegalServer, including these 5 MLP reports. And Ron put my name on there, so I really have to take ownership of them. So I tested them out in my own test site, but if you test them out in your site and have ideas for improvement, please don't hesitate to let me know. Sometimes when you have more data to run through, you might identify something that slipped past me. I'll also note that there's basically the same information in the MLP Open Cases report as in the MLP Closed and Rejected Case report. Some people are really comfortable setting their own filters and switching which columns show up and which don't. So you might be able really to use the MLP Open Cases report for almost everything. Other people get a little bit thrown and are like, how can I run a report on closed cases through a report that is called Open Cases? So that's one of the reasons that I made separate ones, that some people are just a little more comfortable if the report that they're running matches the title of the report. And then here's this non-MLP specific but great thing that's been added that your LegalServer person can activate in your LegalServer site. So at the top there, hopefully you recognize, the My Assignments tab that you're used to seeing with all the cases on which you have an assignment. And your list, I'm sure many of you have quite long lists. And if you add this little plus sign that you can see the arrow pointing to, the black circle with the plus inside of it, if you hover over that, then the list that's in the bottom center of the slide will appear. It doesn't have to be this exact list. Each site can customize what features they want to show up in there. But it allows you to, for example, add a case note at time directly from your My Assignments list. So you don't have to click into your case and then click on Add Time, or you don't have to click into your case and then go to Close Case from the Actions menu. You can do it directly from your home page under your My Assignments list. So this is quite handy, I think, and it's quite easy to set up. So if it's not available yet in your LegalServer site, you should have a quick chat with your LegalServer person about getting it set up. This is a really lovely mural that's at Community University Healthcare Center in Minneapolis. And on the sort of banner, it says, "We all need help in some form or another," which is certainly true. Okay, so the bulk of the call today, I want to focus on managing MLP referrals and intake via LegalServer. Some questions had come up on the LegalServer site administrators list that kind of inspired us to get this session scheduled and to put our focus there. So I mentioned earlier that we're going to have special guests talking about how they have used LegalServer to manage referrals and intakes. And the first one is Rachel Baldessaro from Buffalo, where they are having a lot of snow today. And so Rachel may or may not be on the phone yet because she had to go from one place to another before she was going to join us. So Rachel, if you are on the phone, you can unmute yourself and let me know. Okay, so it looks like Rachel may not yet be on the line, and of course I told her to put safety first and make sure she got safely to where she needed to be. So Elise, I'm going to have you unmute yourself, and I'm going to jump ahead to your slide. Okay, hello. Elise, you can go ahead and take it away. Yep. Yes, we can hear you.
Great. So hello, my name is Elise. I am a supervisory attorney in LAF's Medical Legal Partnership projects. We have several medical legal partnerships here at LAF.
one with a federally qualified health center called Erie Family Health, and that is actually currently in its 3rd year, which is fantastic. That's where I started. We also have another medical legal partnership called Health Forward with Cook County Health, and that is going into its 2nd year, and I supervise that project. And it's a little bit different in its format in that the partnership is working with providers that are care coordinators. And then we have another developing medical legal partnership with Rush University Medical Center with a fellow, and the partnership is focusing on the medical needs of older adults. So the first kind of slide I wanted to share with you all is about our use of the pre-screen program. It's been really beneficial because, as you can see from the top arrow, it can identify what the different medical legal partnership project that we're getting the referral from. So the project that we have at Erie, we get our referrals directly from providers. They generate an electronic order that we find on a desktop. We have access to a desktop that gives us that information, all the information that exists on this pre-screen. For our partnership with Health Forward or with Cook County Health, all of the same pre-screen information comes to us in a fax. So when we're opening up a profile, we go to where you see on the left-hand side of the screen, MLP pre-screen. So again, this is only for medical legal partnerships because it has all these added questions. We can identify that what is the MLP program, MLP secondary program that it's coming from. Is it coming from Erie? Is it coming from Health Forward? Is it coming from Rush? So where is the person coming from? And then what is the funding code associated with it? Okay, the next slide. And then this is in the next screen of the pre-screen. We can look at what medical institution it's coming from. So for example, at Cook County Health and Hospital System, they have several hospitals, they have clinics. At Erie, for example, they have lots of different clinic sites. So we want to be able to identify where this person is coming from, what is the type of provider that's making the referral. Okay, so next slide. So then on the next screen, you can see what so one of the other ways that we triage the pre-screens that come in is what is the level of urgency from that particular situation. We can designate it, and it shows up on our LegalServer as its emergency, priority, or normal, and that is so that we can identify how quickly we need to get in contact with this patient. We generally try to get in contact with a patient within 48 hours of receiving the referral or of inputting that pre-screen. However, if somebody, for example, has an eviction or they're locked out or they have a court case that is coming up, then that becomes an emergency referral. If they have, for example, they're off benefits, something that requires immediate intervention, that might be a priority or an emergency. Or in this case of this example, patient was just talking with their provider and they're interested in obtaining a healthcare power of attorney. So, that would just be a normal priority. And this is Mallory. I meant to point out on the previous slide, just note right under pre-screen notes, the LAF also tracks whether lead poisoning is involved in the case. So that's something that they added above and beyond the system MLP fields.
Oh yeah, that's true. And then also if the patient is pregnant at intake, that was also kind of a higher priority for the particular, so we wanted to track that information and be able to report back to our partners, particularly our partner with Erie, how many pregnant patients are we assisting, and kind of what is the outcome of those cases. Okay, next slide. And then this is another piece that's really useful and important. So, and this is a mandatory field, so it won't let you close the pre-screen until you make a designation of what is the status of this pre-screen. So generally, when we first are inputting all of the pre-screens, we set that to need to call because we haven't called them yet. And then it allows you to designate. So when our protocol is we try to contact a patient 3 times. If we can't get a hold of them by that 3rd time, we'll send a letter that says, here's our contact information. If this is still an issue, you can call us, and then we'll move it up to that reject button, and we'll reject it and reopen it if they get back to us. Next slide. So then when if we hit, ready for intake, we call the patient, we conduct the full, regular intake, just like at any other LegalServer entry. We get to the sort of last disposition section, and then we designate that this is a case that's coming from an MLP program. And then again, those are automatic. If it's coming from an MLP pre-screen, these are automatically chosen for us, and it will open up some additional MLP-specific questions for intake. Next slide. And so these are the questions that are related to the MLP-specific intake. So for example, a lot of times with our MLP from Erie, the patient will be a child, a minor, but the client will really typically be the parent. So this allows us to say all of the pre-screen information, all of the information that we have is for the parent, but the patient is actually a child. So that lets us kind of make that distinction. Then again, we're able to track if there are special social determinant of health risk categories. So, if there is a history, like in this case, history of homelessness, or, there's a various list of social determinant risk categories. And then again, MLP special population, we can indicate whether or not that exists in this case. And again, the blood poisoning and pregnancy, those were 2 specific issue areas that we wanted to be able to track. Next slide. And when we're completing the intake, that we need to be able to designate and circle back with the provider, what is the outcome of this referral? At this point, the intake is complete and we're ready to make a decision on the case. I see there's a question, where does the ICD-10 information come from? So that typically comes from the provider. That was put in there when, our Erie Medical Legal Partnership Project is also with Loyola Law School Clinic. And at the time, Loyola was doing a project and doing some research related to the outcomes of the referrals from Erie, and they were asking us to keep track of that information. That's not something that Erie is really, that research is not going on any longer, and Erie wasn't really asking us to track that any longer. So we haven't been, that piece hasn't really been that integral in what we're doing now. Okay, so then the outcome referral, so this is information that we can then report back to the providers to close the loop, to say, yes, this case is over, or the case is ready for a decision, or the patient actually didn't have a legal issue, or there were some other, like there's a conflict of interest, et cetera, et cetera. Okay, next slide. And then this is another mandatory field related to closing the loop. So for any case that is over the phone and that's going to be advice or just brief service, we will just get verbal permission to close the loop with the medical provider to give them that information, like, this case, we advised on this case, or, we made a warm referral. And anything that goes beyond that, we'll get a written consent to circle back with the provider. Next slide. And then again, this is how we track and report. We need to make sure that the information of where the case came from, so the referring organization is noted here. And when if we try to close the intake without this referring partner agency, it won't let us. It's a mandatory field, so that way we can make sure that we're going to properly track that. Okay. those are all my slides. Is there any other questions or?
Yeah, this is Mallory again. Elise, can you talk a little bit about how, your sort of daily life is different since you set up the MLP features as compared to before? What were you doing before, and how has it made things better now?
Absolutely. Oh my gosh. So prior to, so like I said, our first MLP that I started with was with Erie Family Health. And when we started, it was before the MLP kind of pages in LegalServer were live. So the way we were tracking previously was through an Excel spreadsheet. And let me tell you, the new pre-screen feature and the new MLP module has made things so much easier. We were missing a lot of information. All of the reports that I give to Erie that are from the beginning of the project, there is a big asterisk, and we have to say that it's incomplete information because when it was on the spreadsheet, certain things were getting double counted, some things were not getting counted at all, and they weren't being put into LegalServer because we didn't really have that pre-screen reject process, so we wouldn't be entering the information into LegalServer until it actually became an intake. So this way we can track all of the referrals that don't become full intakes because we aren't able to get a hold of the patient client, or they're saying once we do talk to them that they actually don't need the services or they're not interested in the services right at the moment. So this really has made us much more able to gather accurate information about exactly what happens with every single referral. It's so much easier to keep track of than in an Excel spreadsheet. Like we had multiple Excel spreadsheets, and because we had multiple medical legal partnerships, there were several Excel spreadsheets for each of our partnerships. So this really has streamlined it. It's made it so much easier. It's made the reports that we run just have the information that each partner is looking for. So that has been just a total game changer. It's been so much better, so much easier. It's saved a lot of time.
Great, great. And I'll say also that Vivian Hessel, who's the head informatics person at LAF, set this up with use of the configuration guide and her own considerable know-how. But LAF did this on their own in setting this up. And I'm going to have people hold questions. I saw that Rachel is with us, so I'm going to go backwards so that Rachel can talk a little bit about what they do and how it's the same and how it's different from what Elise and her team is doing. And then we'll see if there's questions for the two of you. So Elise, if you can re-mute yourself, and then Rachel, if you can unmute yourself, then we'll turn it over to you.
Can you hear me?
Yep, we can hear you, Rachel.
Okay. My computer is a little bit frozen, so okay, there we go. So I'm Rachel Baldessero. I am an attorney at the Center for Elder Law and Justice. We are based in Buffalo, New York. Apologies for the delay. We're having minor weather event up here, probably a major weather event by most people's standards. So let me tell you about how we're using LegalServer and the MLP features. So our medical legal partnership is relatively new. We are at a safety net community hospital that we've been there for 2 years. We just opened a brand new partnership at another healthcare facility, another hospital in Buffalo that started in January. So I can give you a little bit of background about how we use the detailed pre-screen, which honestly is one of the most beneficial features, especially for our medical legal partnership clients. So our office in general, we have cases, we use a basic pre-screen, but for our medical legal partnership clients, we use a more detailed pre-screen. Mallory helped us build this out. Her knowledge was extensive to help us figure out what was going to be the best features to use to accomplish the goals that we have. So when you first open our pre-screen, what's nice is that we have the pre-screen program indicated by the arrow there. In our office, we have various programs depending on the type of case that it is or the funding source. So this is a trackable field. We can say this is a MedLaw. That's the name of our medical legal partnership, the MedLaw Partnership of Western New York. So we can run reports to see what cases through MedLaw have come through. So the next part of our MLP build-out is where we track our referral information. So this is the example. Our original medical legal partnership partner is the hospital, Erie County Medical Center. What's nice is that we use this to further break down not only is the referral coming from this particular health institution, but then we can figure out which medical practice, the type of position that the case is being referred by. Each of those little drop downs have a menu. So we have different parts of the Erie County Medical Center campus. There's the main campus, there's several outpatient clinics, doctor's offices. There's also a skilled nursing facility that's on this campus, and we can track each specific location that the referral is coming from. We also track by medical practice area, which is helpful when we're running a report because we can see which practice areas have been utilizing the medical legal partnership more, maybe which partnerships there's opportunity for improvement or additional education so that the referrals from those areas can increase. And then we track referral position also, which might be social worker, discharge planner, physician, nurse, whatever it might be. That's been very beneficial for us to figure out in what areas we can increase our education and what areas seem to be working properly. So similar to what Mallory was talking about before, this section of our MLP build-out talks about whether or not the client is the person who is referred, or if not, what is the relationship of the person who is referred. Very often in the cases that we work on, the person that we're actually working with, our client, is not the patient who's in the hospital, but a family member. We are linked quite extensively with the palliative care and supportive medicine team at Erie County Medical Center. For that reason and other reasons, we see a lot of patients who no longer have capacity, either because of a neurocognitive disease, age, sometimes they've had a traumatic brain injury or some other issue, and their family member ends up being the person that we're working with and providing advice to. The top of the page, I did skip over one thing, the MedLaw referring clinician or healthcare team member. We can use this section to add a contact from LegalServer's contact tab and associate that person with the case, which is very helpful on those days when you're trying to search through your file to say, who is my contact here at the hospital? Who's the person that referred this case? In order to get their contact information, here we can type their name in. If they are already a contact in LegalServer, it'll link right to this case. Additional things that we track are the special population categories and social determinant of health risk factors. Our social determinant of health risk factors are probably similar to most individuals. From what I understand, they follow the National Center for Medical Legal Partnerships suggested categories. In our special populations categories, we have some things that are a little bit different. Primarily, we're tracking whether or not someone is a cancer survivor. Our funding sources for our medical legal partnership come in part from a breast cancer foundation, and then in part through our healthcare partners. So for that reason, we track whether or not an individual is at risk of breast cancer, whether or not they have a breast cancer diagnosis, if they're a survivor, and then we also track if they are receiving breast cancer treatment or receiving cancer treatment of any type for any cancer. So those are the specific categories that we added in order to better report to our funding sources. On this page, you'll also see the top portion of health information where we can track whether or not an individual has had emergency department visits, how many per year, and then how many hospitalizations per year. The hope here is that for folks who are high utilizers of the healthcare system, that if we are involved and we help settle some legal issues, that number will decrease. Okay, for legal info, same as most people would have built out in LegalServer, we can put in our legal problem code, the assigned iHelp category. We have the status referral from the partner, our healthcare partner. So this would be referral received, person needs contact, whether we've accepted the case or whether the case have not been accepted for whatever reason. Additional information. So this is, how did the person hear about us? Typically in these cases, it's a referral from the hospital. We do get a lot of referrals, however, just from, we met someone at an outreach event, or we met them, their family member we had worked with before. So we can track how that person actually came to our agency, whether they or not they are a hospital patient. And then we have an option for both primary and secondary funding codes. So this is helpful because, again, for reporting purposes, we are funding these cases under a particular medical legal partnership specific funding code. What's nice is that we have a secondary funding code as well for cases that we use this typically for cases where someone is a hospital patient, but the referral didn't come specifically from the hospital. Maybe we met them at an outreach event or something else. So we can use that mostly for reporting purposes to track cases under multiple funding codes. So I talked a little bit about this already, the status referral received from a healthcare partner. So when a referral comes in, we'll enter it in as a pre-screen. It allows us to keep all the information in one place, particularly because with our medical legal partnership, we have multiple locations. We have a satellite office inside one hospital, we have a satellite office inside a second hospital, and then we have our main office downtown. Using LegalServer, because it's web-based, is a great way for all of the partners working on the medical legal partnership to communicate, especially because for those of you that may have more than one medical legal partnership location, there's a lot of overlap and a lot of crossover. So it's helpful because we can all communicate about what's going on. So when we have a case that comes in, we'll pick the status of the referral received or whether something else needs to happen in the case. Okay, so here's our home screen. So we have the callback, assignment, incomplete intakes, pre-screens, and recently accessed. For the callbacks, we use this section of LegalServer for if someone else in the office, other than you personally, takes a call and you need to return the call. So these would be cases where a call has come in, either our front receptionist answered the call and put it in that I need to make a call back, or maybe a paralegal who's working with me on a case spoke with someone and there needs to be some communication. This is a great way to track any callbacks that may need to be made, particularly for people like myself who are working remotely from the main office. It's just an easier form to communicate back and forth. Okay, so pre-screen profile view. Okay, so in our pre-screen, we add in a spot to make notes. We use these typically like case notes, or if you're adding case time to a particular LegalServer case. Again, it's very similar to if you had an open case, a regular case, but here we can keep details about what's happening in a pre-screen. Our office uses pre-screens typically initially when we go to meet with someone to determine, in our case, whether or not that individual has capacity and can work with us. We use it to determine whether or not there's really a legal issue that's going on here. Maybe it's a social issue and not something where they need an intervention by an attorney. So we can keep track of, in the notes section, who's talking to that individual, what the context of the conversation was, and whether or not this is something that our office can assist with. If it is, then we may convert this pre-screen into a full LegalServer case. If it's not, if it's more limited duration, we'll keep it just as a pre-screen with the notes here, because very often that person may end up coming back to the organization looking for help on the same or a similar problem. Okay, So under the MedLaw info, we have the pre-screen summary, the detailed pre-screen, and then we have a whole section for medical legal partnership information right in the pre-screen. You can see here it has information about when the referral was received, a way for us to track how long it's been since the case has come in, and help us to triage the importance of reaching out to this individual, whether it's an in-person visit at the healthcare facility or a phone call to them or a family member, depending on what's going on. We can also track, similar to the slide we saw previously, the medical institution that has made the referral and the practice area and position of the person who's made that referral. Similarly here with our Buffalo General Medical Center, we have the option to pick various options as to who made the referral, where the referral was coming from, so we can again track and see which locations need more help in understanding how to use the medical legal partnership in the referral process. This is our newest addition to the medical legal partnership. We've only been there a handful of weeks, so it's still a learning process for our folks at this location. Okay, so general intake. This is a screenshot of cases, or a screenshot of our client demographics page. This is used for every case that comes through the Center for Elder Law and Justice, whether or not they are specifically a medical legal partnership case. So we ask whether or not that person, the client, is a patient of either of the healthcare facilities that we work with. And you'll see whether or not they're ECMC patient, yes or no, whether or not they're a CALIDA patient, yes or no. If the answer is yes, then there is a drop down because that particular healthcare institution has multiple hospitals and locations. So we can check which hospital location they are a patient of. It is a way for us to track to our healthcare partners, not only the cases that are specifically coming through the medical legal partnership avenues, but generally their patients in the community that we help.
Okay, Rachel, any last thoughts that you want to share before we open up to questions for you and Elise? I
want to touch on what we used to do before we had the medical legal partnership build out in LegalServer. So before then, we had a system called Time, which is a legal services case management system, and it just simply doesn't have the same tracking capabilities that LegalServer has. We would have cases in this client management database, but I did use a spreadsheet to track what essentially were pre-screens, referrals we had received that didn't result in an actual case. It was annoying and complex because we had to go to multiple databases to get the same information. When we obtained LegalServer as an office, it was about 1.5 years ago, and we started using the pre-screen category right away and built out the medical legal partnership features thereafter. And I would say there's a world of difference because there is the ability to track specific data that only would be used by medical legal partnership clients and easily filter that data in reports. And it has made my job and the reporting that we do to our grant funders much, much easier.
Great, thank you, Rachel. And I'll say the work that Rachel and I did together, and I'm sure that Vivian and LIF and Elise worked on this too, was to really make the MLP information only show up when it's relevant. So I know there's always a concern that you don't want to be cluttering up LegalServer with information that non-MLP projects don't need. So we always work hard to make sure that we use branch logic and other things so that the information is there for MLP cases and then not there for non-MLP cases. And for, as Rachel said, they were already on LegalServer before we did the MLP build out. So we were able to sort of stay within the workflow plans that they had already set up when they migrated from their old system onto LegalServer. So are there questions that anybody has for Rachel or for Elise? And let me say thank you very much to both Elise and Rachel for sharing your setup. And Leah, I'm going to ask you to check the chat and let me know if there are any questions that we should address.
Yes, there are a couple of questions. I don't know if they're relevant at this point or if you want to keep them until the end. We've got some questions from Bob and also C. Herrera in the chat as well.
If they are specific to managing referrals and intakes, let's talk about them now. Otherwise, let's hold them for the end.
Okay, the first one might be a little bit specific to intake. It's where does the ICD-10 information come from? The second one is more just related to the My Assignments tab, so that might be one we might want to hold on.
Okay, so yeah, so that for programs that collect the ICD-10 information, I can't remember exactly what ICD stands for, International something Codes of Diagnostic something. So it's basically diagnoses for those who are not familiar with it. So anytime any of us or any of our clients go to the doctor, then there's going to be at least one ICD-10 code that's chosen, maybe more than one, by the clinician, and that's used in billing, and it's also used in sort of monitoring, as I say, international. So this is the 10th version of the ICD-10. So for the MLPs that track ICD-10 codes through LegalServer, they're getting the information from the healthcare partner. So the healthcare partner is including the ICD-10 code when they're sending the referral over. There are some MLPs that I think consider using the very top level, the ICD-10 category, that's one of maybe 14 buckets that they might identify themselves. Like the person is like, oh, I have asthma, so it would fall into the pulmonology bucket. But for the most part, that information is coming from the clinician. It's not something that the attorney is trying to identify or paralegal is trying to identify on his or her own, because that's not appropriate, as we're not clinicians. Okay, so we have about 12 more minutes together, so I'm going to go ahead and move forward, and again, trying to make sure we leave time at the end. You're also welcome to call or email me to talk about this more. I think this is a great mural. I'll note that it was painted in 2010, and I think the sentiments in this mural have become only more relevant as time has gone by. I did wanted to share another quick screen showing that people can customize. This is another homepage that they can customize the tabs on their homepage with information. This is a anonymized site, which is why Bon Jovi showed up there as the last name. Which I kind of enjoy the name Fifi Octavia Bon Jovi, but anyway, and this is a report. So you can embed reports under your tabs on your homepage so that you can have things that update in real time as things are changing. So I just wanted to show that as an example. And then we're not going to spend a lot of time on this today, and I think I actually won't even show this as much as I thought that I might. But I also just want to mention online MLP intake as another way to be managing referrals. And there's a really complex MLP in LA County that has 4 legal partners, only one of whom uses LegalServer, and they received substantial funding from the LA County Department of Health Services to run this MLP and to support patients with complex medical and social needs and support community health workers. And we set up an online portal for all of the referrals, requests for technical assistance, as well as actual client referrals to come in through online, where they're managed and then assigned out to the various 4 legal partners. And I know of at least one other, and I think more, MLPs that are considering setting up LegalServer online portals so that the clinicians with whom they work, the healthcare institutions with whom they work, can enter in referrals directly through an online portal, and then that would be sent directly into people's sites to be managed. So I'm just going to show, I'm going to pause my share here for a moment and just pull up very quickly. So this is the MLPLA site. Whole Person Care is the Medicaid waiver program of which their medical legal partnership is a part. So you can see here we set up a bit.ly, a short little URL for people to use so they don't have to have this whole thing, and then they can choose that they're referring a specific participant, a specific patient, or if they have a general question for the MLPLA team, that's a request for technical assistance, they can enter it there. And then just to show you really quickly, you can see, sorry, that the community health workers can select their name from a list. This is a geographical designation that's relevant in LA County, the geographical region that they're coming from. If the participant is enrolled in one of these other programs that's funded by the county, then you indicate which program they're coming from, and so on. So it looks a lot like a prospective client online referral that you may have seen before, but it's specific to the community health workers to enter in the referral. And so this one is quite complex because the program is complex, but you could also set one up that was quite simple. So I'm not going to go into that in detail, but I really think there's a lot of opportunity there, and I hope that people are really thinking about how they could use that to support the work that they're doing. Okay, so just one moment here. I'm going to come back into my slideshow. Okay. So for an update, I want to mention one of the improved features that I mentioned before that's just coming online is that you can now indicate, you can see the lower arrow there, originating agency program. So I'm showing this example also from Neighborhood Legal Services of LA, which is the lead legal agency for the LA MLP that I was talking about. They get online transfers, online intake and cases transferred from several different projects. And one of the reasons to have originating agency program is to be able to differentiate between the transfers coming in from different projects. So as I mentioned at the beginning, maybe you have a general online intake that you use for your organization where anybody who wants to become a client can enter information, but then you can also enter more specific ones. So you can show that the case is coming from your MLP, and then you can filter so that there's different tabs for the different transfers. And I should say that a lot of these improvements are being funded by a TIG, a Technology Innovation Grant funded by the Legal Services Corporation that was awarded to Montana Legal Services. So Montana Legal Services deserves a lot of credit for pushing these forward with legal aid. Okay, so sort of following that plan, I'm just going to really quickly talk about some of the current and future projects we have, and then we'll go on to questions. So these things are not yet available, but are in the works, or fingers crossed in the works. One is the ability to schedule a clinic appointment directly from an online intake. So for example, if you set up so that your healthcare provider, your healthcare partners were sending referrals over through an online intake, if it was a case manager or somebody who's sitting with a patient, they could also choose an appointment when you were on site at their clinic through the online intake. Human ID, which I'm not going to go into, but hopefully is going to help us with reports sort out when, as both Elise and Rachel talked about, that the person that you're serving as your client is not the patient who was referred, but you want to report on all patients or all clients. We're hoping for some upgrades to recording the ICD-10 codes for the programs that use that to make it a little bit easier. And then also possibly adding what we're calling a submitter's email. So one of the things that we've been thinking about and the community health workers in LA are asking for is confirmation via email that a referral was received. Right now, LegalServer is not set up to do that, but we're hoping to be able to do that so that they can automatically get an email indicating that the referral they submitted has been received. And then later in 2019 and into 2020, we'll be working on developing an API between LegalServer and electronic health record system. An API is basically a link that makes it possible to send information back and forth automatically and electronically. So for example, you know, in our perfect world, the referrals could be sent directly. It could be put in the electronic health record the same way that all referrals are put in to the cardiologist or another specialist, as well as to the legal team, and then it would basically auto-populate a pre-screen. So we'd be reducing double data entry. And then also potentially, of course, with client permission, you know, potentially sending information back at the end of a case about a legal outcome or other things that would then be populated in the electronic health record system. Obviously, a lot to think about with that, but we're really excited. Okay, so with our 4 minutes left, if Leah, you could read a couple of the questions that have come in.
Okay, absolutely. So we have one that's just, do these cases look any different than others in an attorney's My Assignments tab?
Yep, so for the most part, the cases are not going to look any different from the other types of cases that you have. If you want, and I think a lot of MLPs do want, to set up an extra row of tabs in their case profile view that include the MLP information, you can set up an MLP profile view so that MLP cases have that extra row of information, but other people's cases do not have that extra row of information. And that case profile view, we definitely spent time on in the introduction, that introductory email, I'm sorry, that introductory video that talked about the features generally. So you can take a look in there to get a feel for what it looks like, but I think people overall love being able to access their MLP information from the case profile view.
And then the next one, is there a module for assigning Z codes to closed cases for reporting to hospital partners?
Yeah, so that's a great question. So Z codes are sort of quasi healthcare codes that are used to document non-health specific issues. So somebody might have a Z code that included like involvement in the criminal justice system or school issues or other things like that. So to date, we have not set up specific Z codes for reporting back, but there's no reason that we couldn't do it. So there's two ways to think about it. One is that a program could create customized site-specific fields in their own LegalServer and start collecting that information to share back. We can also have a conversation about if it's something that enough programs want to do, then we can approach LegalServer about creating a new system field that would track some of those Z codes.
All right, I think we have time for at least one more. For the health information gathered in the pre-screens, like number of ED visits or hospitalizations, are you relying on client self-reporting or soliciting information from the healthcare provider?
Yeah, so that's another great question. It depends is the answer. So I think a lot of times it depends on where that question is being asked. So if it's included with the referral that's coming directly from the healthcare team, then I imagine that they are pulling it from the EHR. They might also be just asking for patient report. And then when it's collected at intake, it is just collected from patient report. So it's not something that you can kind of take to the bank, but I think most projects use it as a tool to give them a sense of how often the person has been interacting in a really intensive way, either through the emergency department or hospitalizations with their healthcare system. Okay, so we're at the top of the hour. So just a couple last things that I want to mention is that this is, of course, there's so much for us to talk about, and I love talking about it. So I just want to talk about a couple of places we will be talking about it soon. So there's a LegalServer training coming up in Puerto Rico in April. I will be there and would be thrilled to talk with you there about anything MLP related or LegalServer related. And then also the National Center, after a year off, is hosting the National MLP Summit in September. last time we had a LegalServer affinity group so that we could all get together and talk about things, which is really great. And I know that we'll be doing that again in September. I also hope that we'll host another MLP Community Call with LegalServer maybe sometime this summer. And of course, you're welcome to be in touch with me just to have a quick call to bounce ideas off each other, or if you want to talk more specifically or formally about working together, I'm happy to talk at any level about these things. It's like my favorite topic of conversation. So that went by so fast. Again, I want to thank Rachel and Elise for sharing their sort of real world experiences. I know it means a lot to see what your fellow frontline practitioners are doing. So we really appreciate you taking the time out to do that. Thank you all for being on the call today. And then also my final thank you is just thank you for the work that you do to make our communities more healthy and to increase health equity. It's incredibly important. It's really inspiring, and I really appreciate the opportunity to work with you all. So thank you for your hard work on behalf of your communities. Stay warm, drive safely, and we'll be back in touch either in Puerto Rico on another community call or at the MLP Summit in September. Take care.